If you want to know about toxins, this is a great book. Toxic Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities and Chronic Environmental Illness by Neil Nathan and foreword by Robert Navio. In the old medicine, most diseases were caused by acute problems stemming from infections, acute exposure to toxins, or physical injuries. Today, healthcare workers spend most of their time caring for patients with chronic illnesses that last for years. These new chronic illnesses have both genetic and environmental causes. They are echogenetic diseases that occur because the chemistry of the environment is changing faster than our genes can adapt. 80 to 90% of clinic visits today are follow-up visits for patients with illnesses that modern medicine can make a little better with conventional treatment, but with rare exceptions cannot cure. To prevent these disorders, we need to clean up the environment. But to treat these disorders, we need a new kind of medicine. Dr. Neil Nathan has woven into the pages of this book the first descriptions of a whole new book of medicine. While the first book of medicine was focused on treatment for acute illnesses, the second book of medicine will collect the science and art of caring for patients with chronic illnesses. Using examples drawn from a lifetime of practice in the care of patients with Lyme disease, mold toxicity, mast cell activation, Bartonella, porphyria-like crisis, and many other complex clinical disorders. Highly sensitive patients often face denial and dismissal from mainstream medicine. This occurs in part because 30 years ago, when today's physicians were in medical school, highly sensitive patients were so rare as to be relegated to anecdote and were unable to be studied systematically. For example, when a standard blood test like a comprehensive metabolic panel is normal in a child with autism spectrum disorder or in an adult with myalgic encephalomyelitis, chronic fatigue syndrome, ME/CFS, it is not helpful in guiding either diagnosis or treatment. Repeating the CMP 3 times does not give a doctor 3 times more information. The patient is clearly suffering, but the old tests are blind to the problem. New tests are needed, like a new lens. Advances in medical technology are giving doctors a new way to see and diagnose disease. In the pages of this book, we encounter for the first time a new understanding of pathophysiology of chronic illness, built upon a deep understanding of the cell danger response. New treatment approaches are also described, creating a practical toolkit for managing complex, highly sensitive patients with chronic illness. Some of the tools described today will change and be expanded over time. But these first steps will help guide physicians and patients alike to a more hopeful future where chronic illness can become a thing of the past and recovery of health becomes the routine outcome of new medical care. Robert K. Navio, MD, PhD Professor of Genetics, Biochemical Genetics and Metabolism Departments of Medicine, Pediatrics and Pathology Co-Director, the Mitochondrial and Metabolic Disease Center, School of Medicine. So that was the foreword by Dr. Robert Navio. What is mold toxicity? There's mold in them Tar Heels when it comes to the most sensitive patients. I have emphasized and will continue to emphasize that mold toxicity is the single most common contributing cause of that sensitivity. Accordingly, this chapter is the longest and most detailed one in this book. It is my hope that this information will be valuable for healthcare providers and patients alike. At this time, other than my ebook Mold and Mycotoxins, there isn't much available for either group to read that gives a complete perspective of what is known about this subject, and it is my intention to translate that material into a form that is relevant for especially sensitive patients. Mold toxicity is far more common than is currently recognized. Those who are knowledgeable in this field estimate that millions of people are wrestling with this problem but are entirely unaware of its existence. Mold toxicity goes so unrecognized by most medical practitioners that a patient bringing it up as a possible diagnosis is usually met with a blank stare or worse, incredulity. This requires patients to become their own healthcare advocates because they cannot rely on their physicians to make a diagnosis of which those physicians are unaware. Despite its prevalence and importance, this field was barely recognized until 2005, when Richie Shoemaker, MD, published his pioneering book, Mold Warriors. Our current knowledge, though helpful, is still limited by a lack of scientific studies that would inform us how to work in this field with more precision. What we don't know far outweighs what we do know, but what we do know is extremely useful and allows us to help the myriad of patients who would remain ill without intervention. The good news is that some pioneering physicians have grasped the significance of accepting mold toxicity as a valuable diagnosis, and we are making rapid improvements in our abilities to treat it. I anticipate an explosion of increasingly scientific new information in the near future, so please view this chapter as simply the best introduction I can provide today. What is mold toxicity? A toxin is simply a poison. Microbes in our bodies can produce these poisons that make us sick and then sicker, a phenomenon referred to as biotoxicity. It is fairly obvious that microbes, bacteria, viruses, fungi, parasites, and other infectious agents can make us sick by causing infection, and it is equally clear that treating for these disease-causing microbes will make us better. But what is just now becoming clear is that not only do these microbes make us sick by causing infection, but some of them can, in the process of being killed by our immune system, release toxins into our bodies that make us even sicker. Because these toxins are made by microbes, which are living biological systems. They are called biotoxins. This term distinguishes them from other types of toxins, such as heavy metal toxins or synthetic toxins, that are not made by living systems. Doctors are beginning to appreciate that some of these toxins remain in the body and are difficult to excrete or destroy. Thus, they accumulate to make things a little more complicated. Many of these toxins actually compromise the body's ability to detoxify, so that as they accumulate, they become increasingly more difficult to eliminate, creating a vicious downward spiral. The body's natural method of processing toxins is to concentrate them in the body's main organ of detoxification, the liver. Once the biotoxins congregate in the liver, they are bound to bile and sent out into gastrointestinal tract for release in the stool. However, the body's natural recycling system, called enterohepatic circulation, recirculates the bile when it reaches the small intestine, so the toxins still attached to that bile secreted by the gallbladder go back to the liver rather than leaving the gastrointestinal system, and thus accumulate in the body. Hence, even when the immune system kills the invading microbes, the remaining toxins can continue to plague us with their harmful effects. Not everyone is subject to this problem. In about 75% of the population, the immune system recognizes these toxins and uses its defense mechanisms to destroy them. Unfortunately, the remaining 25% are genetically unable to make antibodies to those toxins. These are the patients who are prone to becoming progressively sicker as toxins accumulate in their bodies. Mold toxicity is not new. It is described in some detail in the Old Testament, in Leviticus 14, which warns that if a man's house is contaminated with plagues, mold, and leprosy, he shall have the inside of the house scraped all around, and the plaster that they scrape off they shall pour out in an unclean place outside the city. It has been known for decades that mold toxicity can be a significant medical problem, yet relatively few studies have been published on this topic. In 2003, Dr. Michael Gray and his research team published several papers that clearly demonstrated both immune and nervous system dysfunction in more than 200 patients with mold exposure from water-damaged buildings, and the team proposed that this condition be called mixed mold myotoxicosis. Still, the medical profession did not realize how commonly this occurred and how ill patients who were exposed to mold could become. Along with mold exposure, all of these illnesses shared a pattern that was consistent and treatable. We suspect that other microbes will be implicated as our understanding of this problem deepens. I would like to emphasize, as Dr. Showmaker correctly points out, that when we talk about mold toxicity, we are including not only the presence of mold itself, but also mold spore fragments, volatile organic compounds, VOCs. Symptoms of mold toxicity. We have a special word in medicine that describes a symptom so specific that the mere mention of it is sufficient at times to make a clear diagnosis. That word is pathognomic. It is particularly relevant to mold toxicity, in that quite a few symptoms are so particular to patients with mold toxicity that we immediately gravitate toward that diagnosis. Specifically, they are electric shock sensations, ice pick-like pains, vibrating or pulsing sensations running up and down the spinal cord, sometimes confined to specific segments of the spine. If these descriptions are associated with many of the symptoms listed below, particularly muscle weakness, numbness, and tingling in different parts of the body, disequilibrium, dizziness, severe anxiety and depression with fatigue, and cognitive impairment, joint and muscle pain, headaches, gastrointestinal symptoms, and chest tightness and pain. The possibility of mold toxicity should immediately jump to mind. Unfortunately, patients with these symptoms often find it difficult to put their experiences into words, and they have learned that when they try to do so, eyebrows will be raised, especially if their doctors are not familiar with mold toxicity. They find themselves instantly judged as having a psychological condition, and their doctors stop listening to their descriptions. Medical arrogance, alas, is such that if a patient describes something a physician has not yet studied, those symptoms are in the patient's heads until proven otherwise. Mold patients quickly learn to be very careful about how they describe their symptoms, and it often takes them time to feel safe enough to fully open up. So when I hear even the faintest hint that a patient is experiencing some of these symptoms, I ask open-ended questions that are meant to convey the following. Yes, I have heard these descriptions before. You are not alone in this experience, and these symptoms are meaningful to me. They tell me not only that this is not in your head, but that there is a physical cause that we can diagnose and treat. If they can be elicited from understandably reluctant patients, descriptions of these unusual sensations, patients often characterize them as weird, can be key in diagnosing mold toxicity.